Hey, this is Michael, and this is Surviving the OR, some tips for successful intubations and really getting the most out of your OR experience in school. I know a lot of you have never been to the OR, never had that experience, so we're just going to talk about a few things about how to interact with the staff, what to expect, and how to get the most out of the time that you're going to have there. So first we'll start with the basics. This is really kind of basic stuff for just about any clinical experience. You want to be on time. Okay, this is a busy OR. They got a lot of scheduled cases, and they're not going to wait around for you. So you got to be there on time so you can get dressed and get ready to go. Be nice. Be nice to everybody. The people that greet you, the secretary, security guards, the anesthetist, everybody you're going to run into. Just be super, super nice, and that's how they're going to remember you. And they'll let you do more stuff. Be flexible, move from room to room. They're probably going to move you around pretty fast, so stay up with that. Be present. Don't mess with your phone. My advice to you is leave your phone in your bag, so you're ready to learn everything they want to teach you. Be inquisitive. Ask a million questions. Everything you've ever thought about asking of somebody down there, ask and ask and ask. Be teachable. Every little tip they give you, the way they tell you to do stuff, even if it's not exactly the way you learned it, just be ready to accept all that education. Be quick, follow them around. Again, they're going to move you from room to room pretty fast. Be ready to stay. If an airway comes up whenever you're almost ready to go home, be willing to stay to do that. And be willing to do any airway they offer you. If they offer you an LMA or whatever, even though it's not really not what you're there for, that's kind of what you're there for. And be ready to ask for help when you need to do something different. And the two most important rules: don't be a jerk and don't break any teeth. Those are the two things that will not only get you thrown out, but will likely get the program not invited to bring students back anymore. So one of the first things you're going to notice when you actually get back with the patient is how they're positioned. They're going to be in the sniffing position. They may ask you what that terminology means, and this is what it means: is their head's up about 3 inches off the bed with their ear canal aligned with their sternal notch. This makes it easier for them to visualize and also easier to oxygenate. Speaking of oxygenating, they're going to do this. They're going to start this pretty early through a mask, just like this one. And they're going to monitor it differently than we do out in the world. Whereas we look at the oxygen saturation, which they're going to do too, they're also going to monitor a thing called end-tidal O2. So you may have heard of end-tidal CO2. They're looking at end-tidal O2. And they're basically measuring how much oxygen is coming back out when the patient breathes out. And as this approaches 100%, that's a really, really good indicator that they've achieved proper oxygenation and nitrogen washout, which allows them nice, long, safe apnea times during the intubation attempt. So just take a second look at their screen and you'll see that. So the next thing is the procedure itself, and then they'll want to know which kind of blade you want to use. You have two choices. The Macintosh blade, of course, is the curved blade, the most likely one you're going to see. And my advice, if they offer you a blade choice, the other one, of course, is the Miller blade, which is the straight blade. I would ask them which one they would use for this particular patient, or which one they prefer and why, and then they can go through the finer points of how to do that and how to use it. And that's just the easiest way to learn and the best way to learn from them. Whichever one you're going to use, you're going to start the same way. You're going to enter from the right side of the mouth and sweep to the left. Real important thing here is to make sure that you don't rock back on the handles, that you're pushing forward kind of to the wall is where you want to go. You don't want to rock back like this. This is not the way that's going to work, because that's going to break some teeth. So we don't want to use this technique. Once we get in there, we're going to want to sweep that tongue to the left side. That's going to get it out of the way, kind of compress it up into the floor of the mouth, and get down where you can see this guy right here. That's what you're looking for, the epiglottis. Regardless of which blade you use, this is what you're aiming for. So we'll start with the Mac view first, and in the Mac view you're going to indirectly lift the epiglottis. So this is a video laryngoscope view of how that would look. Now you're not going to have this view from the inside. What you're going to see is something more like this, and the epiglottis is right there on the top. You're going to fit into the vallecula, which is that space above it, and that's going to indirectly lift it up out of your way. The Miller view, you're going to directly lift the epiglottis. So you're going to get down there the same way, and instead of seeing the whole epiglottis like that, all you're going to see is up underneath. And of course, this is from the video. What you're going to see is from the outside is going to look something a lot more like this. Just looking down through that channel on the blade. And so you're going to see the vocal cords like that, and that's where you're going to pass your tube. Finally, again, you're going to be in the sniffing position. Make sure they're pretty well oxygenated. You're going to approach, regardless of blade, from right to left, sweeping that tongue out of the way to the left. Another real good tip, too, is you're learning, and some people do this their whole career, is call out what you see. Call out the structures, your tongue, your epiglottis, all those things as you move your way down. That's going to help the anesthetist or the anesthesiologist know that you're not lost. Know that you're seeing everything you're supposed to see. And then when you're ready for a tube, you're going to ask for that if you need suction, whatever. And they're going to be right there behind you to help. If you're using a Mac blade, find that epiglottis, find the vallecula, which is the space above it, and then you're going to lift straight up to help move that epiglottis out of the way. Remember, lift, don't rock. If you're using the Miller blade, find the epiglottis, lift the epiglottis, and again, lift, don't rock. The most important thing here is that you're moving forward, and they're going to be watching, is making sure you're not rocking back and putting pressure on those top teeth, because they will break, and you don't want to break teeth. That's bad. Most of all, have fun. This is a great experience, one that a lot of you haven't had before, and you may never really get something so focused like this again. So make the most out of that time. Be willing to stay. Be willing to do the extra work, and take every single tip they give you and learn from that. Because again, you may not see something like this again. If you have any questions, you can reach out to me. I'll be happy to help you. And good luck and have fun.